part of my own motivation in starting this podcast is to share the knowledge that so few get to access and how to help their loved ones navigate the challenges of getting their memory diagnosed. And then after diagnosis, all of the questions that come up with a dementia diagnosis. Today's conversation with Rohan, who is one of the co-founders for a platform called Roon, Roon, is really the next level of information giving done in short video snippets by vetted experts, including yours only, where you can ask real questions about your loved one's disease, and the platform will offer you many different experts' answers to the same question. I hope you find this useful. Welcome back to Ask Dr. Mia podcast. And today I'm very excited to tell you all about a technology platform called Roon, Roon. And I also have Rohan Ramakrishna, who is a professor of neurosurgery and one of the co-founders for Roon, joining us today. I know Rohan and I have chatted before this recording, and he and his co-founders started Roon because they wanted patients to have a trusted source of medical information rather than from Dr. Google, basically anytime and anywhere. So welcome to the podcast, Rohan.
Thank you, Mia. It's great to be with you, and appreciate the opportunity to chat.
Thank you. Well, I guess one of the first questions that I like to ask my guest speakers is, who are you caring for right now in your life?
Well, I don't think I'm caregiving right now, but I am parenting with my wife. Our kids of three, our three kids who are 9, 6, and 2. So it's quite busy, as you can imagine, with kids in that age range. But as they say, small kids, small problems. So it's bigger kids, bigger problems. So it's really quite fun and enjoyable to be in this particular phase of their lives.
Yeah, my kids are 8 and 5, almost 9 and 6. So I think it's a great age. And we are not brave enough to try for 3. I feel like that third one will just tip us over.
Yeah. Well, the third one has to just learn to survive, in that kind of environment. So
exactly.
It's been fun to see, actually.
Wonderful. So I know why you started Roon, but I'm curious, how did you start Roon? Because I think not everyone can build up a technology platform like you guys have built. I'm just curious, how did you start it?
Well, it takes a village. I think, to your point, why did we start it? How did we start it? Just had this set of observations from my time as a practicing neurosurgeon where my patients were getting bad information, terrible information from the internet, right? From Dr. Google, from WebMD, from Reddit, from Facebook groups, TikTok, Instagram, etc. And, I wondered, why is this the best that we have? On the one hand, we can get an Uber instantaneously. We can get a package from Amazon tomorrow. We have rover circling Mars. But when it comes to getting personalized health guidance, we're kind of still in the Stone Ages, And so we asked the question, what would it take to give everyone a free personalized guide for health powered by the knowledge of the world's best experts? And that's sort of the motivating factor behind why we build Roon. To your question about how we do it, it does take a village. My co-founders include people from Pinterest, and the idea there was to mix the best of consumer technologies with the best of medical, so that we could, develop something that really resonated with patients and families and met people where they are, so we can give people trusted information whenever they need it. And so at this point, we have a growing team, many engineers, lots of doctors, and then all the different experts that come together, close to 1,000 and growing rapidly, of physicians and other experts who've come together to kind of power the system.
That's great. And I know one of the great things about Roon is that it is free, but it is not free to set it up. So how does the funding work on your side?
Yeah, so we are a private company, and we have raised investment funds to help power this and to hire the kinds of talented people we need, in order to develop and grow Roon. In terms of how Roon will sustain itself in the long term, Roon will likely have some sponsorships, to help power and fund the service. But for now, forever, our goal is to keep it free, to every patient and caregiver out there.
Perfect. And speaking of those caregivers who might be listening, what is one main takeaway that you want people to leave with after they listen to this particular episode?
You're not alone. There's so many people that are dealing with the same thing you're dealing with, or similar things. And Roon was created so you don't have to feel alone, right? Roon answers many and all of the questions that come up in a healthcare journey, not just the medical, but also the practical and emotional. So when it comes to dementia, for example, the emotional questions might have to deal with caregiver burnout and how do you deal with this, and the depression or the anxiety that you might feel when you're taking care of someone with dementia who has a lot of needs, and you're struggling financially, etc. There's also the practical, like if I need respite care, how do I evaluate that type of facility? How do I, if I need a nursing facility, how do I evaluate that? I mean, all memory care, all these practical questions, which many doctors, not for any fault of their own, don't really know the answers to.
Mm-hmm.
And so we harness that knowledge. And then, of course, like I said, the emotional. I'm having trouble dealing with this. How do I deal? How do I move forward? And so we, across the medical, emotional, and practical, really cover everything that people are facing when they're dealing with an advanced dementia diagnosis. And
Yeah.
so I think the fact that you're not alone and you can get an instant answer anytime you need it, that's what Root is here for.
And that's great. And I think of Room almost like the TikTok of reliable medical information. I know that's not a nothing for or against TikTok, but I like the fact that it's digestible, small pieces of information in a video format, which, as we know with other technologies, is oftentimes very engaging and easier for people to take in than, say, reading an article or sometimes even listening to a podcast.
Yeah. Yeah.
Uh,
The, I think the video aspect of it is really important because they're short videos, but you see the people that are giving you the answers, right? And so I think that piece of it is extremely important because what we're trying to do is build a trusted ecosystem, the most trusted ecosystem when it comes to health information. And I think, uncited text or, from what God knows which source is not very trustworthy, right? In the current world of AI, there's infinite information. There are infinite sources that are out there that claim to have great information. But where do you get that nuanced information where an expert can break down what was in a publication or what was in the news or what it's really like to get Leqembi, one of these new monoclonals for Alzheimer's? What is the real world evidence of how it actually works in practice? I think those sorts of nuanced questions and answers, don't really exist anywhere else except on Roon. And so we're really proud of that.
Yeah, that's great. And how do you vet experts to find the best of the best who can explain complicated topics in digestible format? Because I know the CV is certainly one thing and our resume, but that doesn't always mean that people can explain things in a way that is not only accurate, but also personable.
Right. So we actually speak and vet every single expert on Roon. And I should mention that experts are not just doctors on Roon. Experts are social workers, PT, OT, speech therapy, financial and legal experts who can help you with that aspect of caregiving. Really anybody that has expertise to lend across any aspect of a health journey, right? And so those are our experts. In terms of how we find them, we kind of, we surveil academic facilities across the country to look for people who have a expertise and focus in this area, specifically whether it's Alzheimer's or frontotemporal dementia, et cetera, Lewy body dementia. And we, interview them, and we make sure that they fit that, overlapping Venn diagram of being both a great clinician and also a great communicator. And so once we talk to them, we bring them onto the platform, and then every piece of content on Roon is actually evaluated both before publication and then continuously afterwards, so that we can make sure it remains accurate and up to date.
Great. Yeah. And I know you get a lot of information from the users of the technology as well. How do you know how do you track what people ask and who to go after in terms of providing that needed information that may not be currently available on Room?
So before we launch any condition, we actually populate the service, the particular condition, let's say in this case, dementia, with thousands of questions and answers. So when we launch something, there's already a very sizable corpus of information. And it turns out that corpus that we launch, whether it's dementia or any of our other conditions like glioblastoma or ALS or menopause and women's health in general, which we're launching now, um, it turns out that those questions we launch with roughly capture 80-90% of the questions people have. And then that remaining bit, you can ask questions on Roon, as you just mentioned. And then based on the type of question, we will, if it's unanswered, we will find an expert, the suitable expert to help answer it. And so we can usually get those answers back very quickly. And it's, a really delightful experience, I think, for patients and families across the country, because it's almost like an instant expert opinion, right? Wherever you are, doesn't matter if you're in Lexington, Kentucky, or Dearborn, Michigan, or Scranton, Pennsylvania, or New York City, where I am at, you can get an instant answer from, a world expert. And this is like one of the great value propositions of Roon.
That's great. And how do you know whether people are looking for a better answer or that they're not satisfied with the answer that they're getting with existing videos?
Well, they don't tell us necessarily what their motivation for asking the question is, right? They just ask the question, and then we do our
Hmm.
best to give the right answer. So I can't really say what the motivations are behind their questions, but certainly it's an informational gap that they have. I mean, that's why they're asking it. But in terms of whether they're satisfied with their current healthcare or not, I think hard to know. But I think we can generally say that people are dissatisfied with their access to healthcare, right? When it comes to getting an appointment for a neurologist or a geriatrician or et cetera, there's often a long wait, right? No
Hmm.
matter where you are in the country, and you only have limited time with your doctor. The average, depending on the specialty, might be between 11 and 20 minutes. And
Right.
so how do you possibly get all your questions answered, right? Just what, if your main question when you go to the doctor is about, let's say, difficult behaviors in someone with advanced dementia, you can spend that whole time talking just about that. But then
Hmm.
there's a billion other questions you might have, right? Around maybe it's a memory care center, maybe it's a nursing facility, maybe it's, practical and emotional help for yourself. Like there's all these different things that you just don't have the time to get to in the doctor's
Right.
office.
Right.
And so I think hopefully Roon can help fill those gaps for people.
Right. I guess going back to that core set of questions that you launch for each condition, how do you know and how do you determine what is a core set of questions?
Well, we have a pretty big medical team. And so we evaluate, we kind of learn the condition, and we can do that really rapidly because we're a team of doctors. And then we study what people are asking on the internet, on social, et cetera. And we kind of bring all that data together to create the questions that, we populate on Root.
Gotcha. Thank you. And then one of the questions that I know I had, and I think the audience is also might be curious, is that, because this technology is free now, doesn't necessarily mean they'll be free forever. What would you say is sort of the business model for Room?
Well, as I
Yeah,
talked about
yeah,
before,
yeah.
our goal is to keep it free forever. Right? That is our goal, and that is our intention, and that's what we aim to do. And whether you're in Bangladesh or India or New York, we want to give you a free, personalized expert guide for health. So that's our mission. And as I mentioned earlier, our goal in terms of funding this is through sponsorships. And so we haven't done that yet, but and that won't be for some time in the future. But like I said, the goal is to keep it free forever.
Great. Thank you. Are there anything that has been surprising to you when launching Roon, or and then the process of meeting with all the different experts as well as hearing from users?
Yeah, I mean, I think I've been pleasantly surprised at the reception Rune has gotten, both from patients, families, doctors. Um, I think doctors, love taking care of patients. That's why they went into medicine, right? So if you kind of ask a doctor what's the most fun part of their job, it's really just sitting in front of a patient and helping them get better. And I think as we can attest to in medicine nowadays, there's so many other factors that are less pleasant when
Mm-hmm.
it comes to being a doctor or working in healthcare. But that physician patient interaction is ultimately what keeps us in medicine, right? And keeps us motivated to keep practicing. So I think Rune, what it does for doctors, is it helps amplify that aspect of it. As you know, you're on Rune. We ask you the questions that patients ask, hopefully, and hopefully you can use, and we see this, right, that doctors use Rune to help supplement and augment the education of their patients, both before, during, and after an office visit,
Mm-hmm.
because they're help building this new knowledge ecosystem where, again, patients can get expert answers anytime and any place. And so I think doctors have really glommed on to the fact that Rune takes the best part of medicine and kind of scales it up for the world.
Yeah.
I think on the patient side, it's been fascinating too, right? Because we get the beauty of Rune is it's available anytime, 24/7, right? So there's no call center, you just get your answer immediately. And that aspect to be able to see these experts that you would never have access to potentially ever, and get sort of their nuanced view of the world, in your particular condition, I think really resonates with folks. One of the statistics that we love to share is there's 2,000 neurologists in Massachusetts, and that's more than the number of neurologists in all of India, right?
Mm.
And so how do we, and even in Massachusetts, there's an access problem when it comes to neurology. So think about other places where there's much less physicians. And so if you think of migraines, just think of, if you have migraines, there's like a 6 or 9 month wait to see a neurologist in most places. Well, a lot of that stuff, hopefully you can start getting some information about how to like think about migraines and like what the workup is going to be, and things you can do ahead of time before your first visit with the neurologist. So you're not just waiting, right? And so giving people agency in their healthcare is something, in addition to information, is something that we're really passionate about and something we're really working hard on. I think Jonathan Rosen, as an example, is a professor at Harvard, and he has this brain health score, right? And in the brain health score, talk about all these things that you can do to prevent dementia,
Mm-hmm.
and they include social relationships, right, and having a sense of community around you, and avoiding exercise and avoiding diabetes and things like these. Like, you know, much of this is probably not news to people. Like, be healthy.
Right.
But I think on the flip side, hearing it from people in a nuanced way can help give you agency to implement those behaviors in your life. So, we're really excited about this opportunity to not just educate but influence people into better, healthier lives.
Yeah, and I have to say, as an expert who have recorded with Roon, all of the questions have been really similar to what patients and families have asked me within the clinical encounter itself or after the clinical encounter. I guess the only potential downside, it's not really a downside, it's just not knowing um, the specific scenario behind a question, because as a clinician I want to automatically ask back to the person who asked the question, so what do you mean by X,
Yeah,
Y, and Z?
right, right, right.
But I try to answer to the best of my abilities, but that's also the benefit of having multiple experts sort of answering the same question, because we may each interpret that question in a slightly different way and provide a slightly different answer, but overall will provide a complete answer to the person who's interested in the answer to that question.
Yeah, and I'm glad you brought that up. I mean, we do ask um, questions that have the opportunity to have lots of different nuanced perspectives to multiple doctors. And the reason we do that is just as you said, there's lots of nuances depending on the patient population you treat, your particular cultural experience, et cetera. And so we want to kind of capture all of that and, be able to surface it to people, because how people might practice given facts on the ground in Louisiana versus Texas versus Pennsylvania may be different. So we need to
Mhm.
make sure that we capture all those different, perspectives that go into how we take care of patients.
Great. And I know, I'm guessing that most of the users and experts are based in the United States. But I also know that there are some folks who listen to this podcast internationally. And as you said also earlier, that the access to experts is oftentimes much, much less in countries outside the United States. Do we know, or do we have experts who are based outside of the US or users based outside of the US within Room?
So most of our experts are United States experts, but we do have a few that were or are based in places like Canada, India, et cetera, that we've the UK that we've found. But we want to grow that over time, of course. In terms of our audience, we're in over 100 countries today. So we have lots of users from all over the world. English speaking for the most part. In the future, Rune will be in multiple languages, and so we're excited to do that. But yeah, so far we're in over 100 countries, and I think that's growing, which is great.
Wow, that's amazing that it's already in 100, more than 100 countries. So great. Well, thank you so much for joining me today, Rohan, and thank you to those of you who are listening. Where can they check out Roon?
Yeah, so you can go to roon.com, Roon.com, on your mobile phone or your desktop or laptop, or you can download Roon for your iPhone from the App Store. Just type in Roon, Roon, and it'll be one or two down from in the search box. So, and we'd love to see you there so we can help.
Perfect. Is Roon currently is the app currently available in Android or only iPhone for now?
There's not a specific Android app, but for Android users, you can access it using your mobile browser at
Gotcha.
room.com. Yep.
Gotcha. Okay, great. Well, thank you again for joining. If you have enjoyed this episode, please share it with someone who might also want to hear about Roon, and talk to you all next time. Thanks.